Hi guys, it's Dr. James from Vets Geelong, and today I'm answering a question: why do we vaccinate our dogs, or what do we vaccinate our dogs for, specifically here in Victoria or Geelong for that matter? So, it's a common question we get, and a lot of people ask the question, what are we vaccinating for? And in effect, there are a couple of main ingredients, often referred to as core vaccination, and that would be distemper, hepatitis and parvo. The main risk being for younger dogs would be parvovirus, and that's typically a highly contagious disease for unvaccinated dogs and typically presents with gastrointestinal signs, so vomiting, lethargy, diarrhea, and sometimes really severe foul-smelling diarrhea or hemorrhagic or bloody diarrhea. And in young puppies, sadly, it's something we see in individuals who have never been vaccinated or they're in high-risk situations. It is a fatal disease which can affect young puppies. Fortunately, most times when people present to us, they're presenting the pets early enough in the disease where we can start treatment to minimise the risk of losing that little individual. That being said, the other two diseases, so distemper and hepatitis, are probably less common diseases nonetheless, and they affect things like liver and kidneys. And you tend to find, because people have been vaccinating for years, we tend to find it's less of it going around. Not to say it doesn't exist. The other part of the things we vaccinate for here in Victoria or Geelong would be, I guess, your respiratory diseases, often referred to as parainfluenza or Bordetella bronchiceptor, and that's a specific, I guess, vaccination, so separate to your distemper, hepatitis and parvo. Typically the vaccination comes in two components, often referred to as the C3, distemper, hepatitis, parvo, and the respiratory components. And what you might find is there's different brands available for vets to choose from. Some vaccinations are triennial, some vaccinations for the respiratory ones are given intraorally, in the nose, intranasal, or injections under the skin. And that would be a conversation with the vet, because there may be certain breeds where we choose to give specific injections, or the requirements are such you need a vaccination a little bit ahead of time, so we may choose to give a specific vaccination. The respiratory vaccinations, often referred to as kennel cough or infectious tracheitis, are highly contagious disease, spread contact with dogs, and they get that really dry barking or hacking cough. Often they'll produce a white foam or white phlegm when they're coughing as well. Typically it used to be referred to as kennel cough because dogs would be in kennels sick, and it goes down the line of all the sick kennels. That being said, you can be at the groomers, you can be in the park, you can be outside a vet clinic, anywhere for that matter, and a dog could be sick, start coughing and infect your dog, and that's why we tend to vaccinate it. So guys, I hope this answers your question why we typically vaccinate your dogs and what vaccinations we typically cover here in Victoria. As a side note to this, there are some other vaccinations which are important for dogs. Typically rabies vaccination, that would be for pets travelling overseas. It's not a disease we see here in Australia or Victoria. And the other disease would be leptospirosis. And again, it's probably made the headlines in more recent time, been issues, I guess, in Queensland and New South Wales, less of an issue here in Victoria, and it may be something we reevaluate in the years ahead. But if you've got any questions specific about your dog or your dog's vaccinations, reach out and the team are more than happy to help here at Vets Geelong. Speak to you soon, guys. Bye.